Great, thank you so much, Eric, and welcome everyone to the NACDD and FEMA's Innovations in Inclusive Emergency Management webinar. My name is Donna Meltzer, and I'm CEO of the National Association of Councils on Developmental Disabilities, or NACDD. NACDD is the National Association for the 56 state councils on developmental disabilities, or DD councils as we call them for short. They're across the nation in all of our United States and its territories. The DD councils are federally funded, governor-appointed councils that support programs that promote self-determination, integration, and inclusion for all people in the United States with intellectual and developmental disabilities. People with disabilities experience natural and man-made disasters much differently from people without disabilities. They are much more likely to be injured or killed in a disaster, more likely to be left behind in an evacuation, less likely to be able to access emergency shelters, services, and transportation systems. They face discrimination when resources are scarce and experience slower recovery. For the past several years, NACDD has been honored to work with FEMA's Office of Disability Integration and Coordination during Developmental Disabilities Awareness Month to share new information about how communities are working to make emergency management truly inclusive of people with disabilities. This year, we are thrilled to be joined by Sherman Gillums, Jr., Director of the Office of Disability Integration and Coordination, or ODIC, who will share with us his vision for shortening the cycle of emergencies for people with disabilities. The state DD councils were designed to make people with disabilities have a voice in their state decision-making process across all areas of their lives. The DD councils are made up of at least 60% people with intellectual and developmental disabilities or close family members, and work within state systems to raise the voices and concerns of people with disabilities to the state emergency managers and first responders. Working together, often with FEMA, the FEMA regional integration specialists, the state DD councils can identify gaps in emergency services and work to fill those gaps with innovative solutions. We are pleased to have with us today representatives from 2 DD councils who will share their experiences on to share their expertise on the experiences of people with disabilities during recent emergencies. Before I get started, I want to share with you some information about the audience we have gathered for this webinar. This is a critical topic, and over 555 people have registered for this webinar. 134 people identified as having a disability. 107 people identified as being a family member of a person with a disability. We also have strong representation from FEMA staff, state DD council members, state emergency management personnel. It is now my honor to introduce our keynote speaker, Sherman Gillums, Jr., Director of the Office of Disability Integration and Coordination for the Department of Homeland Security's Federal Emergency Management Agency located in Washington, D.C. Dr. Gillums previously led strategy, operations, and impact for the National Alliance on Mental Illness, where he focused the organization's efforts to universalize timely access to mental health care and destigmatize mental illness. He is also the former executive director of Paralyzed Veterans of America and chief strategy and advocacy officer for AMVETS, American Veterans, 2 of the nation's largest congressionally chartered veteran service organizations. A Marine Corps veteran, he served 12 years, medically retiring at the rank of Chief Warrant Officer 2. He holds a graduate degree from the University of San Diego School of Business and completed his executive education at Harvard Business School. He will complete his doctoral studies at the University of Dayton in 2024. Welcome, Dr. Gillums. We are honored and so grateful to have you joining us today to talk about such important issues, and especially during DD Awareness Month.
Well, thank you so much for that kind introduction, Donna. I want to thank you and Aaron Prangley for putting this all together. I also want to acknowledge the speakers from Ohio, New York, and Alabama State Developmental Disability Councils who are joining the webinar today. FEMA's Office of Disability Integration and Coordination values the partnership we have with the National Association of Councils on Developmental Disabilities. Partnerships like this enable us to meet our mission to equitably serve all people before, during, and after disasters. Now, today I will briefly talk about how ODIC is meeting the mission of ensuring recovery for people with disabilities after disasters. This includes adults and children with developmental disabilities that impact physical movement, learning, language, or behavior. And each year, ODIC and NACDD partner to recognize March's National Developmental Disabilities Awareness Month. We are proud to support the work NACDD does with this campaign every year, raising awareness about the benefits of including people with developmental disabilities in all facets of community life, as well as awareness of the barriers that people with disabilities still face when navigating the communities in which they serve. And will somebody advance to the next slide, please? Now, for those of you who don't know me yet, I'm Sherman Gillums, and I joined FEMA in August of 2022 as the agency's disability coordinator, as well as the director of the Office of Disability Integration and Coordination. I always embrace opportunities to raise awareness about the lived experiences of people with disabilities because I have lived the experience of feeling unseen or undervalued as a person with a spinal cord injury. I was honorably discharged, as Donna said, after 12 years in the Marine Corps, and found my purpose in advocacy, starting with championing timely access to benefits in healthcare and moving into broader advocacy arenas to ensure people could fly safely, move through public spaces freely, and receive the dignity and respect they deserve as persons with unique lived experience. I remain a lifelong learner, though, which is why I'm so happy to be here to learn more about the lived experiences of people with intellectual and developmental disabilities, and to help figure out ways they can best prepare for, respond to, and recover from disasters. Next slide, please. The week before last, the FEMA Chief of Staff released my vision document to the workforce called the Director's Intent, which provides a blueprint for how we can reimagine disaster response and emergency management in a way that meets people where they are and makes space for them to be there in their full selves. Now, this document was a result of many interviews, document reviews, and field visits to disasters, where I began to better understand what can and often does happen to a child with autism, for example, or ADHD, or Tourette syndrome, or other intellectual and developmental disabilities, who is being rescued or is in an emergency shelter. As most of you know, intellectual and developmental disabilities are often hidden and can be misunderstood by emergency managers, first responders, and law enforcement members. This misunderstanding can give way to inequities, and you see there I refer to 14 points of inequity. These inequities make the experience even harder for a parent or a child who is already in crisis during a disaster. Now, these 14 points of inequity that occur during most disasters give us in ODIC and our stakeholders and partners a framework within which we can best think through what is likely to happen and take measures to avert those inequities as best we can, with the end goal being to shorten the disaster cycle for all people, with an emphasis on those who rely day to day on assistive aid services, devices, and caregivers to live. Next slide, please. Now, here are the 14 points of inequity, which typically start before the disaster, when people with lived experience are not at the table during planning to ensure unique aspects of their needs are accounted for. Aspects such as alerts, information on evacuation, when and where to go. These must be factored into the design of plans to include those with intellectual functioning or intelligence that affects how they learn, reason, and problem solve. And many people with IDD, especially younger people, trust people of authority in uniforms as a sign of safety. So preparedness should include engaging with law enforcement, emergency managers, FEMA volunteers, and the National Guard to ensure they're educated on these things. Other inequities happen once they're in the shelters. And I just returned from Mississippi, where we have people slowly populating the shelters there after the tornado. And we see things like blocked path of travel for people in wheelchairs, inaccessible restrooms, and language that is not clear, simple, and direct. We encourage parents and caregivers to think about this as they create an emergency plan that includes what you might need to evacuate, such as a disaster kit or what we call a go bag with medications, phone numbers, assistive aids, spare batteries, and anything else that might be unique to a situation. And I want to give you some examples of required kit items for people with IDD and what they may want to consider including. Things like handheld electronic devices charged and loaded with video games and activities, spare chargers for those electronic devices, and a way to keep them charged, sheets and twine, or a small pop-up tent to decrease visual stimulation in a busy room or to provide instant privacy when it's necessary. Something like a pair of noise-canceling headphones to decrease auditory stimuli, and even snacks and personal items such as pillows and stuffed animals for kids that might bring them comfort during a crisis. Now, there's no best time to think about this, but there is absolutely a worse time, which is during or after a disaster when you realize you should have planned these things beforehand. What my office does is work with FEMA's external affairs to beta test accessibility features on the new FEMA app for people with disabilities, including a number of features that enable people to customize their app and the experience they have with it. For example, the sounds and the multimedia adjustments, colors and contrasts, fonts, and more. This accessibility widget is expected to be added to the app later this year. You can also visit ready.gov for sample plans, kits, and resources. So I encourage you to tap those resources as early as you can. Next slide, please. Now, on a closing note, disability, and I found this out firsthand, intersects with every demographic across all ages, races, genders, national origin, even geography. For people with disabilities and their families, it is important to consider individual circumstances and needs to effectively prepare for emergencies and disasters. Now, our main goal and message is to use preparedness to shorten the disaster cycle when the unfortunate occurs. Our partner and community collaborations are critical to making this possible. Developmental Disabilities Awareness Month gives us an opportunity to highlight how critical it is for people with intellectual and developmental disabilities, their families, friends, and communities prepare for a disaster. And that's the message I hope to bring here today. Thank you.
Thank you so much, Director Gillums. A great presentation. And again, we're so happy to have you here and part of our DD Awareness Month activities. We asked in advance for folks to share some questions with us, and dozens of questions came pouring in. But we selected one that we'd love for you to answer at this time. So let me read the question aloud, and then we'd love to hear your response. So Diane Lindstrom, who identifies as a person with a disability from New Mexico, asks, in looking specifically at people with developmental disabilities, what is the most important issue to address in order to support their journey to recovery from disaster?
The answer is so simple: inclusion. I know we hear it a lot. It almost, we almost kind of see it lose its meaning, but understanding nuances such as a child with autism and the attraction to water that can become dangerous in certain circumstances, having that understanding allows people to think ahead on what ways we can mitigate the additional dangers. We call it the disaster within a disaster, by having the parents of those children, having people who have lived experience sit at the table and give you the complexity of their lives so we can plan for it. I mean, at the end of the day, your diagnosis doesn't matter. Everybody deserves to be valued. You deserve to be helped, and there ought to be a way to help you. But for some reason, it's really hard for people to understand how different, when you talk about accessibility, what that means to somebody who has a mobility impairment like myself, or somebody who uses sign language, or somebody who is blind, or somebody with a developmental disability. Accessibility means different things to different people. So having an entire section in a safety plan has to contemplate all those differences and the unique ways that people experience developmental disability during a disaster adds different dangers if they're not understood, interaction with law enforcement, all those things. And it's not rocket science. Once they sit down and hear from these folks, it's a lot easier to plan for those moments when meeting their specific needs are possible because we plan for it. But I think inclusivity is the most important aspect of the work that I do.
I love that. Thank you so much for sharing that answer. Inclusion inclusivity, being seen, being heard. But I also heard you say that that has to be woven into the plan. And planning, as we know, is key, right? That's why we're all here today, is to talk about the best way to plan. So thank you for that response. And let's learn a little bit more about planning and preparation and how we address some disasters through some very real-time examples. So now we turn to our State DD Council's panel to discuss how recent disasters have impacted people with disabilities and what local communities are doing to address points of inequity in emergencies. All emergencies are local. State DD councils often provide the expertise, the formal and the informal networks and resources to assist state governments with all aspects of inclusive emergency management. We received several stories from councils about their work on emergencies as diverse as wildfires, snowstorms, hurricanes, tsunamis, volcanoes, floods, and earthquakes. The panelists we have today represent a very small sample of strategies in our network. We encourage you all to connect with your state DD council to learn more about the work that is happening in your state. So today we have two panelists today. I do apologize. We had planned on having three. We were supposed to have Carolyn Knight of Ohio, who was going to be speaking today about the effects of the recent train wrecks in Palestine, Ohio. Unfortunately, she's not feeling well today. So I just want to make that note. And if that is something that you would like to know more about, please do reach out to the Ohio DD Council in the coming weeks. But today we are very honored to be hearing from Kim Berg from the New York DD Planning Council on Developmental Disabilities and Todd Varwick, the Chief Policy Officer at the Western New York Independent Living Center. And they will be talking about the snowstorm emergencies that were faced in the state of New York this year. And then we will hear from Daryl Powell, Executive Director of the Alabama Developmental Disabilities Council. Daryl will speak about how they are working with local media to address points of inequity during severe storms. So I do apologize again, we won't hear from Carolyn, but let's get started with our colleagues from New York.
Thanks so much, Donna. And Eric, I believe you said you were going to.
Yes, I have your slides. Would you like them now?
Yes, that would be great. And while Eric is doing that, I just want to go ahead and extend our thanks to everyone who is attending. This is obviously a very important topic, hence the number of you that have chosen to participate today. And this is ongoing work, right? Especially as we face different climate challenges moving forward. So this is going to continue to be at the forefront of, I believe, a lot of the councils, and then a lot of other kind of local and state and even national planning entities. So my name is Kimberly Berg. I am a program planner at the New York State Developmental Disabilities Planning Council. I'm just going to provide you a very, very brief summary of the work that we have done in this area. And then I'm going to pass it over to our colleague, Todd, who has that lived experience and really important stories to share. And hopefully those will kind of compel people to think about how can we do more of this work? How can we keep pushing forward? So next slide, please. So we have funded two projects through the New York DD Council starting in 2010. So we originally funded a first responder training. So as Sherman mentioned, the importance really of training first responders, especially when it comes to invisible disabilities, right? Ones that you can't see, but that we know affect people's interactions. So we did a 5-year grant on that. And then our kind of second wave of emergency response was an emergency preparedness training. The goal was to train kind of local and county level emergency management staff on proactive planning for people with access and functional needs. So this is doing the front end planning so that when a disaster strikes, it's still going to be a lot of work. It's still going to be complicated, but you're able to still respond to people's needs. So as I said, my piece is really short. I really want to pass it to Todd so we can go ahead to the next slide. Todd, I'm going to let you take it over from here. Todd experienced the storms in Buffalo firsthand. And just for context, the DD council's in Albany. Buffalo's on the other side of the state. So we felt that Todd was really important because he had that lived experience and because of the work that he has dedicated his life to. We wanted him to share his story. So Todd, please take it away.
All right. It's a pleasure for me to be here today and to talk to you about something I should know a lot about. I'm a Buffalo native, born and raised in Buffalo, New York. And if there's one thing that Buffalo is known for, it's snow, right? I also am in Erie County, where there is a very strong relationship between city and county emergency management officials and the disability community, right? So it's not like they don't know we exist, and the disaster plans account for people with disabilities on a macro level. Then 7 feet of snow falls in 48 hours and the world changes. Now there's some really unique things about this snowstorm. I mean, for the record, guys, I'm in my 50s and I was 9 during the blizzard of 77, which is the biggest blizzard in history. The difference between this one and that one is we kind of knew it was coming, right? Weather warnings came a lot earlier than they did in the 70s. So the problems with the disaster response actually started with kind of the disaster preparedness argument, because immediately prior to the storm, which took place on December 23rd, December 24th, December 25th, in preparing for what they knew was going to be a major weather event and road closures, our governor got on TV and told local residents to get their shopping done early and go home and ford up for the snowstorm. And the first problem with that is that people with disabilities, if you need paratransit to travel, you can't do last minute travel to go to a supermarket looking for food. Even if you could get a paratransit ride, right? If you got to the supermarket, it was kind of the Hunger Games in the supermarket. Everybody was trying to ford up. And we knew it was going to be a snowstorm. We didn't know it was going to be this bad, right? Buffalonians kind of, I openly admit, we sometimes have a blind spot when it comes to snow, right? Because we deal with it every year. This was fundamentally game-changing because in addition to having a snow event, it was in blizzard conditions and many folks lost power in their homes for an extended period of time, right? We're talking for some of our families, almost 5 days, right? There's no ability to safely travel, at least not within the first 2 or 3 days. So the ability to get vehicles, to get people with disabilities out of their homes to a place where there was power really wasn't possible. And we had a lot of folks who the support systems that they depend on for sometimes their very health and safety were interfered with. In my case, I actually had an aide that was stuck in my house for 3 days away from her 1-year-old baby because she got to me to provide services, but then couldn't get home. But I am the unusual part of that discussion, right? More often, there were people that needed supports and the supports could not reach them. Because from a disaster standpoint, even essential employees were sometimes denied access to roads because roads were not safe to travel. So this really drove for us a discussion about what the phrase sheltering in place genuinely means for people with disabilities, and how those support systems that the DD systems in each state provide to people with disabilities, how they should be supporting us in the event of a disaster. I mean, coming out of the disaster with our discussions, for example, I love Mr. Gillums' presentation because he talks about a go bag with equipment. And we all know as people with disabilities that there isn't such a thing as spare equipment. There isn't a thing such as spare wheelchair batteries to carry, because Medicaid in our states won't allow us to have that. So what we have is what we have, and we've got to be able to take care of it, and we've got to be able to plan to be able to put our hands on it in the event we need to create a go bag to go somewhere. But this example, like for example, not being able to get food because we know an event is coming, but we can't get to the supermarkets to get food, that's planning for shelter in place way in advance of when we should expect to do that. And we're looking at where we're in New York, for example. I look at where the care coordination agencies were, because we do have the saddest story that I can tell you is that we did have an individual with a developmental disability, and we don't exactly understand why this didn't happen, but he didn't get modified supports so that somebody could remind him that he shouldn't go to his job because it wasn't safe to travel to his job. He attempted to travel to his job anyway, got caught in the snow, and there was a major medical consequence as a result of that because rescue wasn't immediately incoming, and he lost fingers. Right? So we are looking at why didn't the support services, in our case, the CCOs that people with developmental disabilities are required to have in terms of getting services from our state agency, where the CCOs were in helping us once they knew a disaster weather level event was coming, right? And what we should be doing in terms of our person-centered plans in bringing those disaster needs into discussion. For example, for me, I now have a new rule, right? In my house, I keep a box of granola bars and a case of water. Because if I'm going to be stuck without power for 4 days, I should at the very least have basic nutrition and hydration. And if it turns out in any given winter, right, that I don't use them, then I'm going to eat them and then go and buy fresh ones for the next winter cycle. So I'll think of doing that in August or September when I can go to the supermarket before there's a weather event. But again, we have to look at the broader issues about how that affects us, because while I agree with FEMA that planning is the key to survival, right? Recognizing that the go bags and food cost money, and the vast majority of people with developmental disabilities are on the lowest form of federal public assistance there is. So we really have to look at how they're going to get access to food when they're struggling to pay for food when they eat on a daily basis. So how do we expect them to plan in advance for a weather emergency to be able to prep food for 7 days? Or the loss of power for an extended period of time. And in my state and in my county, that's an ongoing dialogue as to how we're going to improve that response, because Kimberly is absolutely right. We're going to see more weather events like this, and we need to be able to be prepared. COVID changed the way we thought about disaster preparedness because the disaster went on for years, right? This snowstorm for us changed it again, because the active modality, that the way we thought about disasters was, look, you got to be prepared to deal with 3 days, right? couple of days for the disaster, and a day at least for people to reach you to get help. The snowstorm taught us that that isn't a 3-day window anymore. That's a 5 to 7 day window. And in some cases, the snowstorm had a problem with extended snow removal, right? Because you can't expect the stereotypical senior citizen who lives next door to you to try and figure out a way to shovel 7 feet of snow off of the sidewalk in front of their house. So while, could I use the phrase typical folks on a webinar? I'm trying to find the phrase that isn't going to offend anybody. Non-disabled persons. All right, the roads are plowed. They're getting ready to get back to work. But we, as people with physical impairments, 4 inches of snow is going to ground a wheelchair from movement, right? And we're stuck in our house until we can get lower than 4 inches of snow on the ground. That wasn't a week. For some of us in Western New York, that was 2.5 weeks. Now, the way we survived that is because, well, we just got out of COVID, right? So how do you survive extended sheltering in place, provided that there's power and light and heat to deal with that weight? Now, I'm happy to answer any specific questions you might have about where we drive that. I don't know if we want to talk about, future recommended steps, Kimberly. I don't know where you want me to go with that.
I think we'll pass it over to our sister council next, and then I think there's time at the end for Q&A. So
perfect.
But yeah, thank you so much, Todd. That was excellent. Thank you.
Mm-hmm.
All right, well, thank you all, and thank you for everything that has been presented up to this point. Of course, we're honored and excited to be among this great panel today. And as we think about our presentation, our hearts and our thoughts are with the state of Mississippi as they continue to deal with their recent tornadoes. And of course, Mississippi typically is impacted before Alabama. And we also want to kind of think about our people of Alabama who were recently impacted, as well as in times past. Just a few days ago, one tornado that impacted my county came within 7 miles of my in-laws' home. So this webinar is very fitting, and we continue to deal with the devastation throughout our state. And of course, as you see, our title is Preparing Alabamians for Emergencies. Next slide, please. We want to give thanks to all of those who are listed: ACL, our National Association, FEMA, our Department of Mental Health here in Alabama, our network, our staff, our council members, as well as WSFA, because without all of these indicated that you see, this would not have been possible. So we do give thanks to all of those. Next slide. Why did we decide to collaborate with WSFA? As you think about it, you see calls from citizens and emails. Early on, we received calls and emails from our people throughout the state of Alabama asking, can we as a council help purchase generators? Can we help with funding shelters, as well as expressing their frustration of not having any warning signs? So we met with our staff, we met with our council members to continue to seek feedback and ideas on what we could do to help our people of Alabama. And from that point, we met with our WSFA several times to kind of brainstorm about what we could do for our people. We had our chief meteorologist to attend one of our council meetings to really discuss what we could do, the importance of the topic, because it is very important that we deal with emergency disasters. And even with the number of tornadoes and the lives lost due to severe weather. Next slide, please. Now, based on the data that we've received that was provided to me, approximately 124 tornadoes touched down in the state of Alabama in 2022. Since the start of 2023, The recent number that has been provided to me was 60 tornadoes that impacted the state of Alabama, with emphasis on the recent tornadoes not necessarily being counted in this number. So that number could easily increase within the next few days or so. These numbers may not be accurate, but that gives you an idea that we are impacted by tornadoes and severe weather. 21 lives up in 2023 has been lost due to tornadoes. So these are alarming numbers for us here in Alabama. Next slide. Based on those numbers, we know that Alabama is the #1 in America when it comes to tornado death per capita. So this is a huge topic for all of us to discuss. So I'm very excited. The emphasis is placed on this at this point. Alabama is no stranger to severe weather, so being prepared is being informed. And so we work very hard with WSFA to educate and inform our people, because that's what we do. We do that very good, educate and inform. Next slide, please. Since some of our people felt that they did not hear any sirens, they thought that they were not warned, I thought it was a good idea to place a copy of an image of one of the pages that's in the weather guide that we've worked with WSFA to develop, and talk about the history of sirens, the do's and don'ts. And we thought it was a great idea to educate and inform our people about the sirens and what they should do and should not do. So this was helpful information to our people. Next slide. And as you see on this slide, this is an image of an ad that we placed in the weather guide to help our people. It talks about our vision, as well as encourage our people to, take their own safety in hand. Just kind of think about their own safety, just getting prepared for just disaster themselves. So next slide, please. And this is a 15-second clip of one of the ads that we have worked with WSFA on in completing. So if you could play that ad for me. I can't hear Eric. Is there sound on there?
I'm hearing it come through. I'm not certain why that might not be playing.
Okay.
But that can be made available after.
Okay, no
after this
problem.
webinar.
It's just a 15-second ad that kind of encourage people to take those weather guides, and it also highlights those people who were involved with developing the weather guide. Next slide, please, Eric. And briefly on this one, I do want to bring your attention. This is some of the results that we had from the ads, the news, the ads that we've had, as well as the guides and the clicks. So to bring your attention to the blue shaded area, we had nearly, during the time we ran these ads, we had nearly 12,000 impressions, which is the number of times the ad was seen. We had a total of 41 clicks, which is the number of times the ad was clicked on. And also the click-through rate is the percentage of ads that clicked against the number of times the ad was displayed. So really, this lets you know that the word is getting out, our people are being made aware, and we're reaching the people of Alabama is what we want to do. Now, of course, we know that number is not where we want it to be, but it's increasing. So we were excited to work with WSFA and other state agencies as well to make sure that our people, especially in the rural areas and the places where they're not really getting the information that they need. So we as a council have made an impact to ensure that people are being better prepared when it comes to saving lives, which is what we want to do. I think that's it for my brief presentation.
Well, thank you very much to our three presenters. You each talked so beautifully about some of the really important ways that you are all working collaboratively to do better during disasters. So I think we have some time to answer some questions now. I've got some that are in the Q&A and some that we brought in earlier. So I'm going to kind of go back and forth as time allows and see how we can answer some questions. So the first one, Sherman, is really going to be for you, for FEMA. And it's in the Q&A, comes from Tom Frank. It says, the National Council on Disabilities said in its 2019 report, Ending Institutionalization of People with Disabilities During and After Disasters, that people with disabilities are often institutionalized improperly during disasters. What is FEMA doing to address this concern? Does FEMA keep records of people with disabilities who are institutionalized during disasters?
Well, I'll talk through that a bit, because when I took over as director last year, one of the problems I heard most in terms of living with the consequences of a disaster longest involved forced institutionalization and premature death. The problem is the states manage a lot of those issues on the front end, and on the back end, what FEMA does is try to create the conditions for individuals with disabilities not to require extended hospitalization because of things like not getting access to prescribed medications, or an exacerbation of chronic conditions that get worse and to a point where they have to be hospitalized, and many never leave the hospital. But these are the types of problems, and I think it was Daryl that talked about Mississippi and Alabama. I went to both disaster sites, and it is hard for me to envision how people whose homes are wiped away are going to find the type of care they need, one, just to live, but two, in a location where the hospital wasn't affected or isn't overrun by other survivors. So these are things that have to be thought out well in advance, because people have lived on those properties for generations. They've had that in their family for generations, and those communities that are destroyed, they'd like to rebuild in those same areas. But what does that mean for somebody with a disability who has to, if they were working, find a job and all those things? And in an instance where family members are tapped and they've got no other choices for their loved one, that becomes a very a personal decision they have to make. And unfortunately, FEMA is not a long-term solution for those types of problems. We work with the state, again, to create the conditions for that not to happen, but it's really up to the community, the stakeholders that we work with, the volunteer organizations, the Centers for Independent Living, and all the various entities that are federally funded to think through those, because that's really where families can hope to lean on for support in that area. And it wouldn't be up to us to track those types of things. It'd be up to a case manager at the state level or at the county level to track what's happening with these families. But it's definitely, I am very intentional about at least making that time within a disaster a moment when we can do what we can and mitigate that outcome.
Thank you for that response. And I'm sure we're living that out in real time right now in Mississippi, aren't we?
And Alabama. I went to Selma, went to Mississippi, just got back last night. Even in Florida, I went down for Hurricane Ian, went to Puerto Rico for Hurricane Fiona. This, Mother Nature has not been very kind to us. But the more we prepare for a contingency, like what will happen to grandma or grandpa, or me as my wife's husband, what's going to happen to me if we're displaced? And it's harder for the family because now I've got these medical needs that need care, and they want to be with me, but I have to be safe first. So these can be very, very hard questions to answer for families.
Thank you. Shannon, who identifies as a family member of a person with a disability from Kansas, asks, what suggestions do you all have for small rural hospitals with limited resources when dealing with disasters such as tornadoes or other natural disasters? I think any and all of you are probably equipped to answer this question or provide some thoughts. Daryl, did you want to perhaps begin on this one?
Well, yes, real quickly. One of the things that I thought about when that question came through was emergency management agencies. Different states have different titles for the management, but that would be a start. Hospital administrators as well, because in order to go into any hospital, you're going to have to involve the administration of the hospital. So pulling those two together is I think the starting point, because EMAs and the hospital's administrators can kind of hear from the people, what's the need, So in order for that to happen, I think that would be the first starting point.
Thank you. Anybody else want to weigh in on that one? Kimberly, go ahead.
Yeah, and I think an important point too, both that Daryl and Sherman, you've kind of alluded to here, is it's not just the responsibility of one entity, right? It really is partnership and making sure that we are bringing all of the players involved in emergency response. So it's not just the hospitals, it's not just the local emergency managers, it's not just local service providers. All of these entities have to work together in partnership and create a plan. So that was what we tried to do with that second grant that I had mentioned, is really having local government staff work with service providers, work with other entities where people with disabilities might interface, and kind of create a tally. Who's in our area? Who is living in our area? Reach out to individual people, find out where they live, what's their address, what are their needs, based on the different type of disaster. What's going to be the best response? Is it going to be a shelter in place? Is it going to be an evacuation to some other safe location? So there is a lot of work. I'm not, sometimes we say, oh, well, it's easy to do it on the front end. It's a lot of work. It is a lot of work on the front end, and it takes a lot of coordination and planning and really in-depth getting to know people as individuals, getting to know their needs. But despite all of that work on the front end, it becomes increasingly hard after the disaster has struck and you don't have any of that in place. Then it's an exponential increase in work. So if we can take those hard steps in the beginning and at least have some sort of plan that certainly is going to have to respond once the disaster strikes, to be able to respond in real time. But if we can take those steps in the beginning and at least have some sort of preparation beforehand, I think that's where ultimately success is going to lie. And Todd, I don't know if you had something you wanted to share.
Because this is coming from a family member, right? You're talking about a small hospital, and I assume in your neighborhood where the disaster is going to occur, your primary medical care may be taken care of by this small hospital. Knowledge is power, right? Knowing what the facility can do and can't do before a disaster strikes is really, really important. It brings in all that stuff we talked about with the emergency management agencies, perhaps providing additional supports to the small hospital, right? And you guys recognizing what the concern is going to be with that hospital when you arrive. It's a complex issue for like a consumer advocate like me to solve, because hospitals are complex entities. The best thing I can say is, if you know that that's going to be a problem, right? And that's the place that you're going to evac to, or that's the place where the medical need for your relative is going to need to be addressed, then we need to be able to make sure in that planning process that they know that that's likely to happen, so that they can get supports and prepare, and that you can advocate on a local level to strengthen the hospital network in the event of disaster.
And add a thought to everything that everyone said, which you covered it all. I'll just add that every disaster is peculiar to their region. In the case of Mississippi, a hospital was damaged. It was in the path of the tornado, as well as an assisted living facility. So that hospital, and also remember, they're run by people who also live in those communities, who also lost homes. So medical personnel, even though we see them in their light as care providers, they're also victims in some senses. So taking into consideration the peculiarities of a particular community, state, culture matters, all those things matter. And in Mississippi, what they're doing is they're erecting a field hospital to, because that hospital was the anchor to that community. And with that out of the way, you don't have like another place to go. So they're going to actually put up a field hospital, as I understand it, that will be supported by other hospitals, which is one way that community has figured out and how to keep people in the area or that are going to stay there anyway, but they may need access to care. As far as the knowledge, Todd is right. I mean, up in East Palestine, those hospitals weren't familiar. I'm hearing that they weren't familiar with cases of toxic exposure to air. And if that was the case and people are having symptoms, that was reportedly beyond the understanding of some of those medical personnel. So knowledge is definitely power, and it's probably going to take more than 1 or 2 or 5, or even the state and federal government. It's going to take a lot of stakeholders to examine the problem and play a role.
I know this is a small comment to make to the audience, but if you get an opportunity to participate in a community local disaster drill, do that. Because one of the things we discovered in New York is the more people with access and functional needs participated in the drills directly, right? Because the problems occurred during the drills and the big question mark bubbles are appearing above people's heads during the drill. So when they debrief from the drill, they're coming up with the answer, right? So if you see a disaster drill that's going to be in that community, that's going to affect that hospital, participate in that and participate in the debriefing for that so that they can get an answer to that likely question.
And I would also
advice.
add, Donna, too, and sharing your story. I think Todd did a wonderful job sharing his story. And when you have the opportunity, whether it be a hospital administrator, EMA director, state agency, or whomever, share your story, how you were impacted. How did it make you feel? What are you going through? What are you experiencing? Those things are huge because sometimes people don't want to just see numbers. They want to see how you impacted, how you affected. So sharing your story, I think that's a huge component to getting the rural, those small hospitals and everyone on the same page as well.
Thank you for that. New York folks, Sarah Lyons asked, did the New York DD Council and maybe the IL as well, did you work with your state and local health departments on your disaster planning? What advice do you have perhaps? Really, this applies to all states, right? So how do you work with all of those proper entities in advance? Todd.
In Erie County, as an example, we have we started a COVID advisory group for the disaster by way of example, but prior to that, we had an advisory council for people with disabilities in the county that included and that continues to include members of the health department. So when we created the Consumer Advisory Council for COVID, we also involved people in emergency management and disaster, right? And the ADA coordinator of our local county government entity, who's got access to people from the sheriff's department, who's got access to people from volunteer fire departments that are supported by the county, so that those things can be discussed on a regular basis as issues occur. I cannot stress enough how important that direct community involvement is, because it's the ongoing version of telling your story, because Daryl is absolutely right. So if the stories are front and center in people's heads, right, that's where they're going to start coming up with the particular solutions at hand.
And I'll add to Todd's comment by saying that if your state doesn't have a disability commission or coordinator or AFN representative who's in the governor's ear, you should be clamoring for one. The time to realize you don't have one should not be when there's a disaster and your governor is giving an update to the public and there's no sign language interpreter standing next to him or her. So the time is now. Florida's one state that probably could use one right now, given all that happens there. So hold your elected leaders accountable for making sure that that is prioritized in their administrations.
So we just have a couple of minutes left here. So I want to do sort of a combination of questions, because as I'm reading all the questions that are coming in, they sort of fall into two buckets here. So I'm going to first ask our DD Council folks to just say a couple of words about how you are involved in your state. What are, maybe give us like your top 3 ways that you are connecting with all of those folks in the state to do your planning. And then last, but certainly not least, I'm going to turn back to you, Sherman, just to talk for a moment about how does the ADA inform FEMA and work to accommodate people with IDD in disaster preparation and response, and what should we all know about that, how to be that best advocate. So quickly from our councils, and then we'll go back to Sherman to wrap us up there.
I guess quickly from me, all of these agencies, they are on our listserv. They get our emails, they get our newsletters. Anytime we have meetings, they're invited. And we also give them an opportunity to kind of speak what's on their agenda. So that way we can connect and network, because that's what it's all about, getting everybody on board, on the table, and working together.
Yeah, and I'll just echo what Daryl said. It's really about maintaining those open lines of communication, finding the champions. I mean, that's the really core of any work, is finding who's on board. And I would say, the state level is really important, but really drilling down to the local level, because the state is helpful and can do a lot, but really it's going to be the people on the ground. As I mentioned, in the case of Buffalo, I mean, as the DD Council, we're located a 5-hour drive away. So it really is like setting up the network on the local level to respond to people's immediate needs, really drilling down to who is going to help in real time in that locality, and setting up those networks all throughout the state in all localities.
Director Gillums, you want to wrap us up here?
Sure. I'll just say that universal design is not disabled design. Universal design is intended to serve entire communities. If you enjoy Alexa, Siri, screen audiobooks, touchless and motion censored technology, those are all solutions that were at first geared toward people with disabilities. And you have them to thank for those conveniences. But in many ways, that's the only way you make communities more resilient, by strengthening those parts of those communities that are most vulnerable in those vulnerable areas and making them strong. And I think that's how you best brace yourself as a community for a disaster that you can't predict or stop, but you can certainly mitigate the disaster within the disaster from happening.
Wonderful, thank you. So I know our chat is just filled, or Q&A is filled with some really great questions. And I apologize that we didn't have time to get to all of them today, but the folks that you see here on the screen and our staff back at NACDD, I know we are all happy to help answer and continue to answer your questions. We will capture all of those questions from the Q&A and do our best to get back to folks with some direct responses. Again, I encourage all of you to go to our website at www.nacdd.org to find where your state council is and how you can connect with them. And if you're in that state, to ask them those specific questions about what can I do in my community? How can I be involved? How do I lift up voices? How do I make sure everyone is included, regardless of their skin color, the language that they speak, their ability or disability, and all of these things. And we will continue in so many other modalities, this conversation that we've had today. I really want to thank our guest presenters today, Kimberly, Todd, Daryl, and Director Gillums. Thank you so much for giving so generously of your time today. And we know that there's a whole team of amazing people at ODIC behind you. And we thank all of them, along with yourself, for being with us during DD Awareness Month. Thank you, everybody.